So for Gracie and I's presentation, we are doing benign prostatic hyperplasia.
Okay, so first we're going to start with just a description of BPH, or benign prostatic hyperplasia. So it's a non-cancerous enlargement of the prostate gland. It's the most common benign tumor found in men. It's common as men get older, and it's also known as prostate gland enlargement. So while the size of the prostate is usually the size of a walnut or a golf ball in adult men, it can grow to be as large as an orange with people that have BPH. So as the prostate enlarges, the gland presses against and pinches the urethra. The bladder wall becomes thicker, and eventually the bladder may weaken and lose the ability to empty completely, leaving some urine in the bladder. So next, I just want to talk about symptoms and then men at risk. So the severity of symptoms in people with BPH varies. However, symptoms tend to gradually worsen over time. So first, I just want to talk about the common signs and symptoms of BPH. So that would be frequent or urgent need to urinate, increased frequency of urination at night, difficulty starting urination, weak urine stream or a stream that starts and stops, dribbling at the end of urination, and inability to completely empty the bladder. And then less common signs and symptoms include a UTI, inability to urinate, or blood in the urine. And then I just want to also mention people who are at risk for BPH. So men over the age of 50, as the risk for BPH rises with age, men whose fathers had BPH, men who are overweight or obese, men who don't stay active, or some men with erectile dysfunction. Okay, so next I just want to also talk about the imaging modalities. So radiographic investigation of the main reproductive system is mainly limited to urethroplasty and intravenous urography. Prostatic enlargement will be demonstrated on an intravenous urography as a filling defect at the base of the bladder. So sonography can also be helpful in the evaluation of testicular enlargements, and pelvis CTs will clearly visualize hyperplasias. So MRI of the pelvis depicting the bladder and prostate gland is normally required alongside a prostate-specific antigen, a PSA laboratory test. So elevated PSA results indicate a positive case.
So some of the diagnostic tests that are used are the initial physical exams. So what they do is the digital rectal exam. The doctor will insert a finger into the rectum to check your prostate for enlargement, because it's very palpable if it is enlarged. A urine test. So analyzing a sample of your urine can help rule out an infection or other conditions that can cause similar symptoms to those with BPH. A blood test will indicate any kidney problems, and the prostate-specific antigen blood test. So PSA is a substance produced in your prostate, and the PSA levels increase when you have an enlarged prostate, just like we mentioned before, how an elevated result will indicate a positive case. Additional tests to confirm enlarged prostate or rule out other conditions are the urinary flow test. So this will measure the strength and amount of urine flow that one has. A post-void residual volume test that's done by ultrasound or inserting a catheter into the bladder after urination to measure the amount of urine left in the bladder. And 24-hour voiding diary. So this is to record the frequency and amount of urine output, because like Gracie said previously, when people have BPH, there's oftentimes where a significant amount of urine will stay in the bladder. So this is what they want to record and update for all of their papers. More complex conditions, a doctor may recommend transrectal ultrasound, prostate biopsy, or urodynamic and pressure flow studies, or a cystoscopy. So for treatment of BPH, we use medication to treat the mild and moderate symptoms. So this could be alpha blockers. These will relax the bladder neck muscles and muscle fibers in the prostate, making urination easier. The 5-alpha reductase inhibitors will shrink your prostate by preventing hormonal changes that can cause prostate growth. Or we can use a combination drug therapy. So a doctor might recommend taking both the alpha blocker and the 5-alpha reductase inhibitor at the same time if just taking one of them isn't effective. Next, we have tadalafil or Cialis. So studies show that this medication, which is often used to treat erectile dysfunction, can also treat prostate enlargement. And so for the transurethral resection, or TURP, it's a common surgery for BPH. TURP uses electric current or a laser light to cut and remove tissue, and it's done under anesthesia with a tool called a resectoscope, and that is inserted through the penis. And it provides light, irrigating fluid, and an electrical loop. And this loop will cut the tissue and seal the blood vessels to prevent any further enlargement. And the removed tissue is flushed into the bladder and out of the body with a catheter. So the outcome of BPH, evidence does not suggest that the development of prostatic hyperplasia increases an individual's risk of develop prostatic carcinoma. So like we mentioned previously, it's a very common benign tumor, so it's rare for it to ever become cancerous. And many men over age 50 will develop multiple calcifications within the prostate. These are termed prostatic calculi, which may be radiographically visible on just a plain abdominal or pelvic image. But the development of these calculi is of no clinical significance. It doesn't prove to show that it will turn into anything further.
All right, so I hope you guys enjoyed our presentation. So here are our references, and that's it. Thank you.
Thank you.